All right, so now we're going to show my favorite way to adjust the first rib. There's a few ways to detect the first rib. One is by trap and scalene fullness in this region. If you get trap fullness going up into the occiput, it's usually an occipital subluxation. If you're seeing it mainly here, it's either a CT subluxation and or first rib. So then use your fingers then to feel the front of the neck and see where you have a little bit more fullness. So for Claudia, it's right here and it's connecting right here. Then I want to see how that first rib is moving. So go ahead and take an inhale. It should move up on inhale and then exhale, and it should descend on exhale. Hers is stuck on the exhale. Usually when first rib subluxates, it subluxates superior and slightly lateral. So the actual adjusting force is going to go A to P, lateral to medial, and slightly S to I. So I like this position, and I'll usually stand up to create leverage. I have my right leg horizontal of the spine, supporting the spine, so that she could lean back into my leg if she needs to. And that provides a little bit of an unload on the system. Then I'm gonna connect to that first rib somewhere along this index finger, this way. So again, I'll find that exact point. I turn my hand over and connect. Then I'm gonna allow the head to start to drift over. And you can see I'm actually using my thumb to help support it so it's not empty space. So it's here, and then I might actually get the whole body to lean slightly. And I want to adjust this usually at whatever point it's sticking in the exhale. So take an inhale for me, let it out, right there. Whew. So continuing through lateral flexion. This is a big one. Usually you'll see, yep, you'll see it here. So if you come look at this, you'll usually see blood flow go right to that area. So I got a lot of, I believe it's arrhythmia, right? So change in the actual skin because there's a lot of blood vessels in that area. And so that's a common reaction. Can be a big endorphin release as well, and person can get lightheaded. So I always like to stay with the person, make sure they're in their body, and then you feel good to walk and stand up? All right, you can stand up.